In tonight's Health Edge, if you're involved in a serious accident, getting the best medical care and getting it fast can make the difference between life and death. Here in Southeast Michigan, chances are good you'll get the help you definitely need. They call it the golden hour. That time right after a serious injury that's most critical to a victim's survival is the time when a level 1 trauma unit can spring into action and provide everything an injured patient needs.
Whatever their injury is, when they arrive in the hospital, this hospital will stop whatever else it's doing and direct its entire power to the care of that patient.
That means making sure an entire team works together in a coordinated manner.
Radiology technology, operating room support, pharmacy, respiratory therapy.
Doctors, including surgeons, are immediately available 24/7.
Orthopedics, neurosurgery, any treatment that a traumatized patient would need is available here.
In the Tri-County area, Beaumont, Detroit Receiving, and Henry Ford hospitals are all certified as adult level 1 trauma centers. That takes a large commitment from the hospital.
It requires commitment in terms of not only dollars, but people and resources.
So how do you make sure you're taken to a level 1 trauma center if you're seriously injured?
Those types of decisions are made by the medical control boards of the various counties of the state prior to anyone being injured.
Captain Tom Colombo is EMS coordinator for the Southfield Fire Department.
Oakland County Medical Control Authority dictates what our transport policies are.
When a person is able to speak, their wishes are considered. Otherwise, the decision is based on county guidelines and ER crowding.
There are times where we have to take you by law to a different facility if the hospital is full.
Michigan is working on a statewide system with criteria for transporting patients to a level 1 trauma center. It's something most states already have.
There are currently activities going on in the state legislature so that Michigan can have a coordinated and active state trauma system. But right now, we're in the infancy of that.
That shouldn't be an issue if you're injured here in Metro Detroit, but if you're on vacation in a less populated part of the state, don't count on being transported to a trauma center.
They're going to typically be taken to the closest appropriate facility.
For a patient who needs to be stabilized, doctors tell us that's probably the best thing. But most still support legislation that would take the guesswork out of trauma patient transport.
So that the citizens of the state can know that when they're injured, either on the road or at home or vacationing, that they are going to get to the right place at the right time.
Hurley Medical Center in Flint and the University of Michigan Hospital in Ann Arbor are also adult level 1 trauma centers, so we're really lucky. Stephen?